causes of ankle and foot pain. Ankle and foot pain can be caused by a variety of factors, including injuries, medical conditions, and overuse. Here I told you some common causes of ankle and foot pain. Sprains and strains. Ankle sprains are among the most common causes of ankle pain. They occur when the ligaments that support the ankle are stretched or torn. Strains involve damage to the muscles or tendons in the foot or ankle. Sprains and strains are common musculoskeletal injuries. A sprain occurs when the ligaments that connect bone to bone are stretched or torn, typically due to sudden twisting or impact, such as in an ankle twist. Strains, conversely, involve the stretching or tearing of muscles or tendons, often caused by overexertion or repetitive motion. Both conditions can cause pain, swelling, and limited range of motion. Such swelling in the foot and ankles causes severe pain. Treatment typically involves rest, ice, compression, and elevation, RICE, pain management and, in severe cases, rehabilitation exercises to regain strength and flexibility. Fractures. A broken bone in the ankle or foot can cause severe pain. A fracture is a break in a bone, and it can occur anywhere in the body, including the ankle and foot. Fractures can result from traumatic injuries, like falls, sports accidents, or car crashes, or they can develop from overuse and stress on the bone. The severity of a fracture can range from a hairline crack to a complete break. Symptoms typically include pain, swelling, bruising, and difficulty moving the affected area. Treatment for fractures often involves immobilization with a cast, splint, or sometimes surgical intervention to realign and stabilize the bone. Healing time varies depending on the type and location of the fracture, but proper medical care is crucial for a successful recovery. Fractures can result from trauma or overuse, such as stress fractures. Uric acid. Elevated levels of uric acid in the body, a condition known as hyperuricemia, can lead to a condition called gout, which can cause severe ankle pain. Gout is a form of arthritis characterized by the accumulation of urate crystals in the joints, often the big toe but also in the ankle and other joints. These crystals trigger inflammation and intense pain, typically accompanied by redness, swelling, and extreme tenderness in the affected area. Gout attacks can be sudden and excruciating. Dietary changes, medications to lower uric acid levels, and lifestyle modifications are often used to manage gout and reduce the frequency and severity of painful episodes. Tendinitis. Inflammation of the tendons, such as Achilles tendinitis, can cause pain and discomfort in the ankle and heel area. Tendinitis in the ankle, often referred to as Achilles tendinitis, is a condition in which the Achilles tendon, which connects the calf muscles to the heel bone, becomes inflamed and painful. Overuse, excessive strain, or repetitive movements can lead to this condition. Runners and athletes are particularly prone to Achilles tendinitis. The pain is usually felt at the back of the ankle and can range from mild discomfort to severe pain. Rest, ice, physical therapy, and anti-inflammatory medications are commonly used for treatment, along with modifications to activity levels to allow the tendon to heal. Arthritis. Osteoarthritis and rheumatoid arthritis can affect the joints in the foot and ankle, leading to pain and stiffness. Arthritis is a common cause of pain in the ankle, particularly osteoarthritis and rheumatoid arthritis. Osteoarthritis results from the gradual breakdown of cartilage in the ankle joint, leading to pain, stiffness, and reduced mobility. Rheumatoid arthritis, an autoimmune condition, causes the body's immune system to attack the joints, resulting in inflammation and damage to the ankle joint. Both types of arthritis can cause persistent pain, swelling, and limited joint function. Treatment typically involves pain management, physical therapy, and in some cases, medications to reduce inflammation and slow disease progression. High diabetes. High blood sugar levels in individuals with diabetes can lead to various complications, including nerve damage, a condition known as diabetic neuropathy. Neuropathy can result in pain, tingling, or numbness in the extremities, including the feet and ankles. Over time, this nerve damage can cause discomfort, making walking and movement painful. Diabetes-related vascular issues can reduce blood flow to the extremities, potentially leading to peripheral artery disease, PAD, which can cause pain and cramping in the legs and feet, including the ankles. Managing blood sugar levels and controlling diabetes through diet, exercise, and medications is essential to help prevent or alleviate these complications. Plantar fasciitis. This condition involves inflammation of the plantar fascia, a band of tissue that runs along the bottom of the foot. It can cause heel and arch pain, especially in the morning. Plantar fasciitis primarily causes pain in the heel and the bottom of the foot, rather than the ankle itself. This common condition results from inflammation of the plantar fascia, a band of tissue that supports the arch of the foot. However, the pain associated with plantar fasciitis can sometimes radiate upward, affecting the ankle and lower leg. The pain is typically most severe when getting out of bed in the morning or after prolonged periods of inactivity. It's often described as a sharp, stabbing sensation. Factors contributing to plantar fasciitis include overuse, improper footwear, obesity, and certain biomechanical issues. Treatment may involve rest, stretching exercises, orthotics, and anti-inflammatory measures to alleviate pain and promote healing. Continuous standing or prolonged weight-bearing activities can indeed lead to foot pain. When you stand for extended periods, it places extra strain on the muscles, tendons, and ligaments in your feet, causing them to fatigue and potentially leading to discomfort. Common issues associated with prolonged standing include arch and heel pain, such as plantar fasciitis, as well as general foot fatigue. Proper footwear with good arch support, periodic breaks, and stretching exercises can help alleviate this type of foot pain. If pain persists or worsens, it's essential to seek medical advice to rule out any underlying conditions and receive appropriate treatment. Bursitis, inflammation of the bursae, fluid-filled sacs that cushion joints, can occur in the ankle or foot, causing pain and swelling. Neuropathy, nerve damage, such as peripheral neuropathy, can result in pain, tingling, or numbness in the feet. Nerve damage, often referred to as neuropathy, can cause significant foot pain. This condition can result from various factors, including diabetes, alcohol abuse, certain medications, or even injuries. Neuropathy can manifest as tingling, burning, numbness, or sharp shooting pain in the feet. Over time, it can lead to loss of sensation and muscle weakness. Managing the underlying cause, pain management, and treatments like physical therapy or medications can help alleviate foot pain associated with nerve damage. Morton's neuroma. This condition involves a thickening of the tissue around a nerve in the ball of the foot, causing pain and discomfort. Morton's neuroma is a condition that can cause pain in the front part of the foot and sometimes radiate into the ankle. It occurs when the tissue surrounding a nerve between the toes thickens and compresses the nerve, often affecting the space between the third and fourth toes. This compression leads to sharp, burning pain, tingling, or numbness in the toes and the front part of the foot, which can extend into the ankle area. Wearing proper footwear, foot padding, and sometimes corticosteroid injections are common conservative treatments for Morton's neuroma. In severe cases, surgical removal of the affected tissue may be necessary to alleviate the pain. Overuse and poor footwear. Wearing improper footwear and overuse of the feet can lead to pain. High heels, tight shoes, and activities that stress the feet can be culprits. Overuse and poor footwear are common culprits in causing ankle pain. Overuse, often from excessive physical activity or repetitive stress on the ankle joint and surrounding structures, can lead to inflammation, strains, or other injuries. Inadequate or ill-fitting footwear lacks the necessary support and cushioning, putting extra strain on the ankle, and may lead to discomfort and instability. Together, overuse and poor footwear can result in ankle pain, emphasizing the importance of appropriate footwear choices and moderation in physical activities to prevent such issues. Wear medicated shoes if easy. This gives you relief and comfort. Flat feet, splinous, and high arches, scavis, abnormal foot arches can lead to pain and discomfort. Flat feet can strain the arch and cause pain, while high arches can lead to instability and pain in the midfoot. Flat feet, splinous, and high arches, scavis, can both contribute to ankle pain. Flat feet lack the normal arch, which can lead to overpronation, excessive inward rolling of the foot, causing strain on the ankle ligaments and tendons. This can result in pain and instability. On the other hand, high arches can lead to underpronation, insufficient inward rolling, which can also cause instability and put extra pressure on the outer part of the ankle. Both conditions can disrupt the natural biomechanics of the foot and ankle, making them more prone to pain and injuries. Proper footwear and orthotic support can often help alleviate discomfort associated with flat feet and high arches. Infections, such as cellulitis, in the foot or ankle can cause pain, redness, and swelling. Peripheral arterial disease, PAD, poor circulation can lead to pain in the legs and feet, especially during physical activity. Peripheral arterial disease, PAD, is a condition characterized by the narrowing or blockage of blood vessels, typically in the legs and feet. It reduces blood flow to the extremities, leading to various symptoms, including ankle pain. The decreased blood supply can cause muscle pain or cramping in the calves, ankles, or feet, particularly during physical activity. As the condition progresses, it can result in more persistent and severe ankle pain, along with other symptoms like numbness, weakness, and skin discoloration. Managing PAD involves lifestyle changes, medications, and, in some cases, surgical interventions to improve blood flow and alleviate associated pain. Referred pain. Sometimes pain in the ankle or foot may be referred from other areas, such as the lower back or hip. Referred pain is a phenomenon where pain is felt in one area of the body, such as the ankle or foot, but originates from a different source. In some cases, issues in the lower back or hip can cause referred pain in the ankle or foot. Conditions like sciatica, where pressure on the sciatic nerve in the lower back can radiate pain down the leg, may manifest as ankle or foot discomfort. Identifying the primary source of referred pain is essential for accurate diagnosis and effective treatment, which may include addressing the underlying condition in the back or hip to relieve the ankle or foot pain. If you are experiencing persistent or severe ankle or foot pain, you must observe that why this pain is caused. It's important to consult a healthcare professional for a proper diagnosis and treatment. He or she must give you proper treatment. In my next video I will tell you about home remedies for ankle and foot pain. Thanks for watching. Hope you like this video. Kindly like and subscribe to my video. Share it with your friends and family. Stay blessed.